Today we're going to talk about male liposuction. Every man hates the love handles, wants a flatter stomach and wants a six-pack. The answer for that is liposuction. What we're doing with liposuction is we are attacking these problem areas. Problem areas of fat are areas that have a high concentration of fat cells. So since there's a higher concentration of fat cells in those problem areas, in the love handles, when calories come in the body, we store more and we store more calories in the love handles, more calories in the stomach. We store more calories there and we store them first. So what we're trying to do with liposuction is we're trying to decrease the concentration of fat cells in those problem areas. Liposuction works because fat cells don't replicate. Once you change the concentration of fat cells in those problem areas, they're changed forever. If we can get the concentration in that love handle the same as the concentration in the back above it, the waist below it, then it's going to be flat and smooth. And once you get it flat and smooth, it's flat and smooth forever. If you get the concentrations even, if you gain weight, it stays smooth, and if you lose weight, it stays smooth. What we're doing with the male liposuction as opposed to the liposuction in the ladies is we're just trying to make the muscles stand out more. The way we make the muscles stand out more is like they do in the movies, in the 600 movies. They paint shadows where they want those muscles to be. What we're doing with the liposuction is over-suctioning in the midline, along the sides of the rectus abdominal muscle, in the indentations between the rectalis muscle. If you follow where the muscle really is, you get a natural look. If your real muscle is here and you make a line here, not so good. Especially if you started to work out, now you're gonna have two lines. So the point is to get the muscles, the lines and the indentations right where the real muscles are. If you do that, it looks natural. So that's kind of the idea of what we're trying to do, with a male liposuction. Physically, when you're doing the liposuction, you're taking a cannula and you're coring out fat cells. So if the muscle is here, the skin is here, the nerves and blood vessels are in between, and you're taking a cannula and coring out the fat cells between the nerves and blood vessels. So now you're making a solid into like a Swiss cheese or a sponge. When you do that, you're making a raw surface inside the body, inside that hole where the fat cells were, and water will weep into those holes. The water that weeps into the holes where you remove the fat cells is the swelling. I think of the swelling like just a soggy, wet sponge. The way we get that to heal is to scar. So we take something, the muscles here and the skin is here. What we're doing is we're taking something that was originally 2 inches thick or whatever, 1.5 inches thick, and we're just letting it squash down into something flat as a pancake. The scar tissue is taking place and pulling that skin back down to the muscle. So we're pulling that skin close to the muscle. So one thing we're doing, we're exposing the muscles that are really there. And we also, if we over-thin, if we take this and thin the area in between, if we thin that more than the area of the muscle, now we're enhancing the look of the six-pack. If you have muscles, it makes the muscles you have show. If you don't have any muscles, it gives you the look of muscles. So that's kind of what we're doing with that liposuction. After the surgery, you got to wear a garment, like the bicycle suit, to compress that wet sponge. You got to do massage to compress that wet sponge. All kinds of things. So everything we can do, the more we can compress the sponge, the faster it will stick, faster it heals, and the better the swelling is. Now, so that's kind of the idea of mechanically what we're doing. Now, so far as the recovery, first day of the liposuction hurts like sting. I mean, it's like a why did I do it kind of pain. And the truth is, men can't take pain. The women do better than the men with the liposuction. So the first day is not that fun. Okay. Second day is better. Third day is a lot better. Usually pain down by like 50% by the third day. First massage is not that fun either. Burning, achy, throbby kind of pain. After the first one into the second week, the massage is more like exercise. I kind of try to teach you ways to do self-massage using body weight and things like that. And I think the massage is kind of the better kind of thing. Now, no exercise for 2 weeks after the surgery. If you do too much too soon, you get more swelling. If you go out and go to the gym the second day after surgery, you swell up like a balloon. So 2 weeks you start light exercise, and then it's trial and error. You do exercise, you get more swelling, too much, you can't do it, wait, try it again later. You do exercise, no extra swelling, you keep on doing it. Now the garment, you got to wear 24 hours a day for a month, and then after that month is trial and error. If you take the garment off, you don't have additional swelling, the garment's off. You take it off, you get more swelling, put the garment back on till the swelling goes down. It will really take 3 to 4 months before you get the final look. You'll see a change the next day. 1 month, 50% of the swelling gone, 2 months, 75%, 3 months, 90%. Everybody has a cleaner look at 3 months than 1 month. It just takes that much time for all the swelling to go away. Most people are back to work, in a week, 5 to 7 days, maybe 9 days, back to work and things like that. But you are like, at a week, you are not full strength. You're maybe like 80% strength. Maybe 2 weeks to 3 weeks, you got like 100% strength and things like that. The key to getting the strength back is drinking and eating, because this liposuction makes you dehydrated and it makes you weak. So now you're in like a building phase. Your metabolism is jacked up. You need all that energy to heal, so you got to eat, you got to drink. You're just eating like an athlete afterwards. You're eating like or you're bodybuilding, you're training, you're trying to build up. You're in a build-up phase. Now, complications. This surgery, it can be done under local. I do all the surgery under general anesthesia. I think the advantage of general anesthesia is airway control. When you have general anesthesia, you have a tube in the throat. If something happens, if there's a problem, you can breathe for the person. You do it under local, a problem, there's not a lot you can do. So I trained as a plastic surgeon. I do all my surgery under general anesthesia. Blood clot. Whenever you have anesthesia, whenever you have surgery, you're at risk for blood clot. When you're asleep, legs don't move, blood sits in the leg and clots. If it clots in the leg, it's called a deep vein thrombosis. Clot races from the leg and goes to the lung, that's called a pulmonary embolism. Moving and drinking prevent clots. To set up for a clot, you're dehydrated and you don't move. The person that drinks and moves, get up out the bed right after surgery, moving, can exercise the legs, every time the calf muscle contracts, the blood flows. That's how you prevent a blood clot. Now, infection can happen within the operation, but it's rare with liposuction. I've seen two infections with liposuction in 19 years. First one I saw was in 1988, and then I've seen one more since then. So it can happen, but it's not that common. You do lose blood with liposuction. Whenever you do liposuction, when you're taking out those fat cells, you lose blood. Your blood count, your hematocrit, will go down by 3 points when you do liposuction and things like that. Other things are complications of anesthesia. You can have throat spasm after anesthesia, laryngeal spasm. You could have pneumonia after anesthesia. You could have lung collapse, atelectasis after anesthesia. If you've never had anesthesia before, 1 in a million people have allergy to anesthesia. I think these are the complications and things you have to think about, when you're going to do liposuction. So we kind of going over things, and now I'll just look at some photographs and try to go over that and show you what we did. So this is a before and this is an after. So this is a guy that exercises, and got muscle, but it's a cover over the muscle, you can't see him. He doesn't like this little pooch. He doesn't like the love handles. So what we did was liposuction the abdomen, the flank, and then the flank going all the way around the back. So you can see our little area extra pooch here. You can see the love handle extending back to tire. So when we do the liposuction, we over liposuction the area in the middle, and then we follow right where his muscles are to highlight his muscles. So now you can just see just a cleaner look, a more competition ready kind of look. And you can see how we've got a straight line here and then a bump and then a straight line. Now we got more straight lines. And you can just see all the muscles just showing. It just looks clean. And you can see the little tire is kind of going afterwards. So that's the idea what we're trying to do. We're trying to thin this exactly. So we're made this part a little thinner, this part a little thinner, this part a little thicker. So that's how we're making the muscles stand out. And if you put them where his muscles are, it looks natural. If you put this someplace where the muscle isn't, it looks kind of strange. Now this is another liposuction, and the point of this picture is not everybody has to have a tummy tuck. Tummy tuck's all well and good, but you'll have a bad scar, and it doesn't give the shape, and it doesn't make the skin contract. Because if you look at him, he's got a skin envelope like this wide and a body like this wide. Unless you get the skin to come down to the body, it's not gonna look so great whether you cut some off the bottom or not. It's really getting those two diameters of the skin to match. And the liposuction, if you do it right, will make the skin contract. So you can see how much tighter this skin is than that. You can see how much tighter the stomach is than that. So it doesn't always have to be, doesn't always have to be tummy tucks. So we did liposuction here at the chest. You see the chest is just a little flatter, the abdomen, and then all the back. You can see that tire here. You can see that tire here, so we got the straight line, and then we got the out, this little bubble and things. Now we got more of a straight line on the back. And you can see how the stomach is just flat. And so skin will contract if you do the liposuction right. You don't do it right, it won't contract. But it can be done. So it doesn't always, you don't always have to have a big old cut, a big scar all the way across your abdomen. I would take, this look over the cut any day. Now here's another look. Not really a lot of muscles. Got a little bit extra in the chest, a little gynecomastia, you can see here. But we did liposuction in the chest, abdomen, flank, and then highlight the muscles. Now this doesn't really look like a guy that's exercising. This looks like a guy that's clean and exercising. And you can see the chest shrinks. The skin shrinking is the key. Again, you see the little tire, the little pooch, it's gone. Now you're seeing the oblique muscles showing. Now we're where we highlighted his muscles. And you can see that's where his muscles really are. We're not trying to make them something they're not. We're trying to make them keep them what they are. But this is just a clean look. It looks good. And you can see again, you go down the back, straight line, then a pooch, a round thing. Now we got a back and then a straight line. We're not trying to make them small waist. We're not trying to feminize. We're trying to make them masculine. Let them come in at the waist and things. Now this is a gentleman who had liposuction and a six-pack done by somebody else, wasn't happy with it. A little asymmetric. Well, this part's bigger than that. Chest is just a little defined. You don't really see the muscles standing out too much. You can just see a little bit too round in the hips, too feminized. You want more muscular look. So we did liposuction in the chest, the abdomen, the flank, and then the outer side of the hips to make it more straight and flat, more muscular look. You just see the six-pack coming in more. He just looks more defined and clean. We did a little extra liposuction in here. But here you can see a line connecting the pec and the lat. You don't really see a separation. Now we're seeing more lat, more pec. It just looks more muscular. You can see the six-pack kicking in. Again, you can see he's had this liposuction before, but still a little loose here. Still out a little bit. Now we got him a little flatter, a little straighter and things like that. Now, the person did the liposuction before, he puts holes on the side to do the six-pack, which I don't think is good. I don't like those scars. For me, I'm putting the holes in the navel to do all the six-pack. We're using curved cannulas and just going out like this, so we're not putting any extra scars. But those scars were there, so there's nothing we can do about it. But I don't like the extra scars to do this. We want to hide as many scars as we can. Now, this is a gentleman that really doesn't have a real six-pack, but we're just giving him a look. The first one had muscles and we're showing the muscles there. This one not really there, but we're giving the look. And you kind of see the chest. You got a little gynecomastia, so we did liposuction in the chest, abdomen, flank. And you just see we flatten the stomach. We add the little highlights where his muscles really are. If he starts exercising, they're going to come out there because we marked exactly where his muscles were. And then, it's going to be a natural look. We see got the stomach flatter, and you can see the straight line and then the out. That little convex. And now you see we got this more straight line and then more straight. This guy's just more muscular than this one. Here's a guy, like super shape, in really good shape. He just wanted more definition in the muscles, and he didn't like the little tire here. Don't like the love handles. Don't like the tire. Doesn't like this. Doesn't like this. Wants to be cleaner. So we did liposuction, abdomen and flank, and now the muscles just standing out more. He just looks even like more cut, more muscular. You can see we get rid of that little tire. You can see how again it goes down, and then the loose skin and the out, the bulging, and now we got it more flat. He looked good before, he just looked better. He just looks better after. Again, we're putting the holes in the navel. We're not putting any holes here and things like that to do the six-pack. If the scars are there, they kind of show things. Now this guy is a little heavier, you can see the pec's a little heavy. You can see a little extra in here. So we did liposuction abdomen, the pec, abdomen, flanks, and then the area between the pec, in this area between the pec and the lat. So we get definition. We don't want to see just one line connected in the thing. We want to see the back of the pec and the front of the lat, so they look cleaner. So this just looks cleaner. There's no real muscle look, now there's a muscle look. You can see here that fat just connecting the pec and the lat. Now we got the front of the lat, the back of the pec. It's more separate. He just looks clean. You can just see that bulge in the tire's gone. You can see again that bulge coming out, and we got it more straight on the back. That's just a nice muscular look. You know, that's just a nice muscular look. What we're doing with the male liposuction is we're working on those problem areas. Those problem areas are genetic. That tire is there genetically. Is, you know, from, you know, you genetically have more fat cells there, so it's going to be the first place you gain weight and the last place you lose weight. Everything else might be cut, you still got a tire. The answer to this is liposuction, because you're decreasing the concentration, that what the genes say where the fat's supposed to be, you're changing it. And if you get it even and smooth, it's changed forever. When you thin things, the muscles that are there show. When you do the extra etching over liposuction, now we enhance what's really there. So the answer for the male with the love handles, which we all kind of deal with, and the lack of the six-pack is the liposuction. The good thing about liposuction is it's permanent, because fat cells don't replicate. Once you change the concentration, they're changed forever. So this is our video on male liposuction. We're going to try to just keep doing more and more videos, because I think you know, when you explain things, I think people can understand, can protect themselves, and can get the things they really want. And we'll see you next time with trying to give you some more useful information. Have a good day.